Good morning, students. Today we will discuss the remaining part of the brainstem, PONS. PONS means bridge. See, this is acting like a bridge. This connection, superiorly this is going to connect with the midbrain, inferiorly going to connect with the medulla oblongata, and either side it going to connect with the cerebellar hemisphere, cerebellum. So here this connect with the middle cerebellar peduncle with the cerebellum. Inferiorly, this inferior border going to connection with the medulla oblongata, superiorly going to connect with the midbrain. Next, we are having the two surfaces. Ventral surface, this is the anterior or ventral surface. More convexity is there, convexity. In the center of this convexity, we can identify one groove is there. This is called the basilar groove, basilar groove. In the basilar groove, due to the presence of the basilar artery, this basilar groove was formed. This basilar artery, it is formed by the union of the two vertebral arteries. This give a like a pontine arteries, anterior posterior cerebellar arteries, labyrinthine arteries, and also here we can identify the posterior superior cerebellar artery, and these two are the two terminal arteries. These are the posterior cerebral arteries. So this is present and relation with the ventral surface of the PONS. Next, and also important cranial nerve here. See, at the junction of the PONS and middle cerebellar peduncle, fifth cranial nerve is there. This is a trigeminal nerve. But at the level of this junction of the PONS and medulla oblongata, the three cranial nerves are there. Abducens nerve, seventh, that is the sixth cranial nerve, seventh and eighth cranial nerves. At the junction of the PONS and medulla oblongata, three cranial nerves. At the junction of the middle cerebellar peduncle as well as the PONS, this is a trigeminal nerve. So it having the two borders. This is the inferior border of the PONS, here superior border of the PONS. These borders relation with the terminal branches of the basilar artery. These are the posterior cerebral arteries lodging here, whereas here inferiorly anteroinferior cerebellar arteries are lodging in the inferior border of the PONS. Next, I can show the posterior surface how it is. See, this is a posterior surface of the PONS. Already I shown the previous video. That is the posterior surface of the medulla oblongata. This is the posterior surface of the PONS. See here, this posterior surface of the PONS, posterior surface of the medulla oblongata, they form a floor of the fourth ventricle. It is a rhomboidal in shape. There is a white color appearance, stria medullaris. Here important points to know. Here anterior median fissure is there, posterior median fissure. Next, two elevation on either side. These are called the facial colliculus. This facial colliculus is formed by when the facial nerve nucleus going attracts by the trigeminal nerve nuclei, it is going to turn around to the abducens nerve. The fibers which are the facial nerve fibers above the abducens nucleus, we are finding that fibers make a elevation in the floor of the fourth ventricle. That is called the facial colliculus. These are the facial colliculus. And also this corner of this above the stria medullaris, we can identify the vestibulocochlear triangle. This is the vestibular triangle, facial colliculus. And also here we can identify superior fovea is there. Blue color appearance is there, superior fovea. This floor of the fourth ventricle connection is there superiorly. There is one foramen is there. See, this is called the cerebral aqueduct. That's superiorly connection. Inferiorly, floor of the fourth ventricle connection with the central canal of the medulla oblongata. So now we are understanding posterior surface of the PONS, posterior surface of the medulla oblongata. These two structures make a floor of the fourth ventricle. And also important nucleus here, facial colliculus is there, vestibulocochlear nucleus is there, and below here vagal triangle, hypoglossal triangle is there. That's why this area is most and more important structure in the posterior surface of the PONS as well as the medulla oblongata. Thank you.